So, postpartum depression screening and postpartum psychosis screening is very, very important and is routinely done, but nothing really replaces the clinical exam. And very often, the signs of an impending depression or psychosis is really in the invisible signs that people are not necessarily seeing. And they may be subtle or they may be very obvious in nature. When you're talking about the clinical exam, you'd be looking for something that's just off from the patient's baseline, something that is unique and different than what their baseline was before. So, for example, perhaps their communication is not clear. Their sentence structure might be a bit incoherent. They may be isolated. They could be agitated. They may not be taking care of the baby in the same way that you would expect. It might be very mechanical in their approach to tasks. Their hygiene might not be the same. The tone and speed of their voice might be slower or faster. It's really important to know what that baseline is. And I think it's also important to note that patients often, even when they're struggling, do have that innate survival instinct, and they can be very adept at hiding their symptoms. And so it's very important that the clinician involves family and friends who know the patient and can weigh in on whether something is just off and they're just not the same person they were before. They're just not right. When we're looking at normal sleep deprivation in the postpartum period versus an impending postpartum depression or anxiety, it can be very confusing and you do need to tease it out. Generally speaking, when you're looking at a normal adaptation, to having a new infant or another infant in the house, or, sleep deprivation from an infant, patients are exhausted. And so, when given the opportunity to sleep, if it's just sleep disruption from having a new baby, they will usually readily fall asleep. They welcome an opportunity to sleep and they don't want someone to come and wake them up. Other than being tired, when they're refreshed, they are happy. That's generally what you see. When we're looking at an impending postpartum depression or anxiety that's keeping someone awake, that's a whole different ballgame. That usually involves unwanted and intrusive thoughts. Um, they're constantly worried about the baby, and so sleep does not come readily to them at all. There is not a feeling of feeling refreshed once they have slept, and it's ongoing, unwanted, intrusive thoughts.